Today, we're going to be discussing the case of a 69-year-old woman who presents to your clinic with a 5-month history of fatigue, decreased appetite, and a 10-pound weight loss. Her past medical history is really otherwise unremarkable, and when you examine her, you palpate right axillary and bilateral cervical lymph nodes measuring up to about 3 centimeters in size. Abdominal exam shows a spleen palpable about 4 centimeters below the left costal margin. Your laboratory workup includes a CBC, which shows an ANC of 1600, a total white count of 11.8 thousand, about 40% lymphocytes in the differential. Her hemoglobin is 8.9 grams per deciliter, and her platelet count is 98,000. Her LDH is borderline elevated at 308, and her beta-2 microglobulin is 3.7. Hepatitis B testing is negative. You sent her for an excisional biopsy of one of her lymph nodes, and the IHC shows a CD20 positive, CD10 positive BCL2 follicular lymphoma, grade 1-2. You fully staged her with a bone marrow biopsy, also to evaluate her cytopenias, and it shows, not surprisingly, paratrabecular lymphoid aggregates, about 45% bone marrow involvement. The molecular genetic studies, again, not surprisingly, come back showing a translocation of T1418, and PET-CT staging confirms your physical exam findings, showing lymph nodes of about 3.1 to 3.2 centimeters, as well as diffusely enlarged lymph nodes throughout the retroperitoneum and lumbar region. She is staged Ann Arbor stage 4 based on her bone marrow involvement. Her ECOG performance status is 1. So she was treated initially with R-CHOP for 6 cycles, followed by rituximab maintenance, 375 milligrams per meter squared every 2 months, and she achieved a partial response as her best response. 5 months after completing her R-CHOP, she unfortunately again complained of increasing fatigue. Repeat PET-CT showed diffuse disease progression, and she was started on bendamustine obinutuzumab for 6 cycles and continued on maintenance obinutuzumab. It's important to note that prior to starting the second-line therapy, she underwent a repeat lymph node biopsy, which showed again grade 1-2 follicular lymphoma with no evidence of transformation. Unfortunately, 9 months after completing her bendamustine component, she complained again of symptoms, this time chills and low-grade fever, and she was started on idelalisib, 150 milligrams POBID.